episode 5 of Aesthetic Chat with Kiki. I'm your host, Kiana Gamble, and I'm so excited to have this guest on. She is our first physician associate to come on the podcast. This is April Harrison. I want to start out by, talking about your story and your journey into the aesthetic world.
Okay, sure. So let's see. I graduated PA school in 2000 and kind of always wanted to go into derm. I didn't really realize I wanted to go into aesthetics at that point, but dermatology was really appealing to me. So started looking for derm positions, which is really, really hard to come by, and wound up working for an allergy group for about a year or so. And, while it was good training after graduation, I really wanted to go more into, skin and dermatology. And so a friend of mine, a colleague of mine, was working at MD Anderson, and she told me that they were looking to hire a PA in their dermatology department. So I reached out to the director over, or the head of the department, and just made contact with her. And she said, absolutely, we're looking, to hire a PA, and we're going to train you and get you, up to speed in all aspects of dermatology. And I mean, it's great because as a PA, we're trained as more generalists. And so I started there, and at MD Anderson, you probably know, it's more of a cancer institution. And so a lot of what we focused on there was, a lot of skin cancer, graft versus host disease, cutaneous reactions to chemotherapy. I saw a lot of cutaneous T-cell lymphoma, or mycosis fungoides and Sézary syndrome, which is a real, fortunately, rare skin lymphoma. So I did that for about 3.5 years and worked alongside the residents. And since it's a teaching institution, we learned a lot. So me and the residents would assess the patient, come up with a diagnosis, order lab tests, and do biopsies, excisions if we needed to, cultures. We would present the patient to the attending, and then they would go in and, confirm or tweak the diagnosis and the plan if needed. So I did that for quite a while, almost 4 years. And while I became more comfortable in it, I really had, as time was going on, more of a desire to go into aesthetics and more private practice where the patients weren't quite as complex. And with a cancer institution, there can be a lot of sad news and some people dying, even though in dermatology, you don't think of that being the case. But with a lot of these skin lymphomas and leukemia and things like that, a lot of patients would ultimately pass on. And nice thing about dermatology is that, or private practice general dermatology, is it's more of a happy specialty, and a lot of the conditions are treatable or curable, and that just kind of fit more my personality. So I contacted one of the dermatologists, a big cosmetic dermatology group here in Houston, and met up with the practice owner. And so she was actually looking to hire a PA at that point as well. And so we were in talks for a while, and she'd never had a PA before. And so we were just trying to figure out how I'd fit into the practice. And that was almost 17 years ago. So I've been at the same practice for about 17 years, and initially started doing kind of a mix of medical dermatology and cosmetic. But as training and learning alongside of her, I just realized I had more of an affinity for the cosmetic side. I still enjoyed medical, especially skin checks and acne, but I really, really liked doing aesthetics, lasers and fillers and toxins, and those things were really exciting to me. So as I continued to practice, over, months and years, my practice evolved to be purely cosmetic. And I never enrolled on the insurance plans because that process tends to take a little bit longer. But once we, I'm fortunate in that my supervising physician was open to, whatever would make me happy in my practice. She wasn't going to micromanage me. She just wanted me to do what made me happy. And so cosmetic dermatology is kind of how everything evolved. And I would do some clinical research. We have a clinical trial arm to our practice as well. And we would do some clinical trials, or I would participate in those. Now I'm just purely cosmetic. Probably 90% of my practice is injectables, and the other 10% is lasers and energy-based devices. Started in cosmetic dermatology. I worked side by side with my dermatologist. So, I observed her for weeks on end and took notes. And then I started doing some of the procedures on employees and family members and friends, and then just kind of started branching out from there. So, in that way, I felt really comfortable because I knew I was doing things the way she taught me how to do it, the way I was trained. So I really appreciated that oversight. I think it would be kind of scary to go out there and just be thrown out with no guidance or training, because you really don't know what you don't know. You have to experience it before you realize, what could be dangerous or what could go wrong in this situation. You know what I mean?
Right, for sure. I think it's the mentorship portion is really vital to be successful in this industry in a safe way.
Mm-hmm. Yeah, for sure. And I think now, especially with social media, there's so much training, education now where we are more knowledgeable on what we need to avoid, what we need to look out for, dangerous things. I'm thinking particularly with injectables like fillers, vascular occlusions, and things like that, where when I started, it was, honestly, we had collagen. We didn't even have hyaluronic acid filler when I was injecting. And so, we knew that you could get a vascular occlusion with collagen or blindness. It was really, really rare. But then as HA fillers came out, we found these things out as we were going, but it was more technique. How can you fill in a nasolabial fold, or how do you fill lips? And that was really it. Nobody was doing tear troughs or temples or cheeks or jaw lines or, anything off the face. So we kind of learned together, but it's interesting how this whole field has evolved over time where, with social media and online training, we are more knowledgeable in, how to be safer injectors and things to look out for as we're working.
For sure. Do you have with, today we have so many places that we can put filler and that people do put filler. Are there some danger zones or some areas of the face that you're completely a no-go, you're never going to inject there, you have and you're never going to do it again?
Let's see. I do pretty much inject everything. I'm thinking about it. I do inject noses. I injected noses in the beginning, and then I stopped as more info came out with, blindness and rates of occlusion. Right. And then I kind of stopped doing them for a while. And then over quarantine, I took an online course with Ayad Harb, and it was very extensive and very thorough. And honestly, I felt 100% more confident in injecting with noses with his technique. So I think it's just about your comfort level and your training, and it's okay to say no. It's fine to tell patients no if you're not comfortable, whether you're not comfortable from a danger aspect or if you just don't think it's the right treatment for them. But yeah, I treat noses, I treat foreheads, I do temples, Piriform. I do it all. And I think a lot of that is because I was injecting, again, back in the day before we realized these are potentially dangerous spots because we didn't really know the anatomy underneath. Again, it was more technique. And so, we were treating noses and temples and foreheads and so you have that comfort level. It's like, well, I've done this before. And then once you get that knowledge on top of it, what I need to look out for, how to be safer, then you combine that together and then you can be safe or safer and get good results. But, I tell injectors all the time, don't push yourself. If you see something on social media, but you don't feel 100% comfortable, you should listen to your intuition. Don't do something that you're not comfortable with, because that's usually when we get into trouble.
For sure. So, I mean, talking about back then, do you think that, looking back now, did you maybe have an occlusion at one point where you maybe didn't know what that was or,
Oh yeah, I'm sure. I mean, I think back and, I probably had a couple and I just didn't know. I remember this one case, I was injecting this patient's lip. It was her lower lip. And looking back, I'm sure I was submuscular just in how I used to inject versus now where I'm just so superficial.
right.
But I just remember one of her vessels. It was just like you clamped off a water hose. It just started filling up backwards. And I'm like, wow, that's so weird. And I just stopped and everything looked fine. There was no pallor. There was no blanching. The skin looked okay. But again, this was a long time ago. We really didn't know the signs to look for back then. And I remember seeing her afterwards and she said, yeah, it was a really bad bruise. It took a long time to heal. And so, in hindsight, you think, that was probably a venous occlusion. And fortunately with the lips, with all the collateral circulation, we've got a lot of, better chance of surviving a VO in that case. But, in hindsight, you look back, you're like, oh, wow, that was probably a vascular occlusion. Yeah.
Yeah, that's just so crazy how much the industry has evolved. Even talking to Melissa, she says the things that, they would do 10 years ago, they would never do now. So it's like, it's good that the industry is evolving and, we have a lot more education now.
Right. Yeah. Thankfully, because I think we're getting better outcomes and we're better at recognizing, an unfavorable outcome. And our techniques too, like even with temples, do you do gunshot? Do you do superficial with the cannula? There's just so many different ways. And I love the ongoing education and the openness for all the trainers with sharing so we can get better and have better outcomes.
Of course. So I have to ask you, what is your favorite aspect of the aesthetic industry?
I just love how we are able to really affect some positive changes with our patients and help them feel better about themselves and, put a smile on their face and make them feel more confident. There's just nothing like that. When they look in the mirror, they're like, oh, I remember that face, or, they just are so happy with how they look. And what an honor and a privilege that, we get to do that we get to be involved in that. I love before and afters. I love seeing, changes and, teasing out those little differences and, just seeing how people are pretty before and they look even prettier afterwards. It's just so gratifying.
I totally agree. Do you have a least favorite aspect about the industry?
Probably trying to identify challenging patients or patients who aren't going to be happy, whether they've got body dysmorphia or unreasonable expectations. I think it's hard to do that in a consultation when I mean, it's almost like dating, right? We're all putting on our best face and, but I think it's so important to be real. And, I don't know, maybe some patients are just, if they're shopping around for the, one person who will do what they ask, or if they really don't see themselves the way other people see them. It's, for me, the challenging part is identifying them before you go down that road and have somebody who's unhappy or, they feel like you didn't give them what you wanted where you did your best. I mean, I feel like we all are in this industry because we want to make people happy. Nobody goes into aesthetics to mess people up. And so if you have an unhappy patient, I think we all take that personally. We all feel like, we can be so down on ourselves if somebody's unhappy. But, the longer I've been in the industry, the more I realize even if you're a pleaser, a people pleaser, you can't make everyone happy. And it's just not possible. And the sooner you realize that you can't, the more freeing it is. And you can tell people no. And, there'll be other patients, if you do it in such a way that they're not offended, they'll, possibly even continue to refer people to you. But I think it's just all about, tact and kindness and saying it in such a way that they don't feel offended, but that's probably not the best fit or that's not something that you're comfortable doing.
For sure. I think that's great advice. I think that especially being someone newer in the industry and, Melissa really does stress, if you see those red flags or if you feel like it's not a good fit, you need to, be the provider in that situation and take control. And, it's better in the long run not to treat.
Exactly. Because it's not like a restaurant where you go and order what you want. You're the provider and you want to do the right thing, but sometimes the patient doesn't always know what's the right thing or what's the right thing for them. And so, identifying that from the beginning is so important, and it'll just save you so much heartache in the future.
So any tips for, the newer injector that's still trying to, hone in and refine their consultation skills, just because that in itself is, an art, and it takes a lot of knowledge and a lot of grace, as you're saying. And, you're telling people what they potentially need to do with their faces. It's not a necessarily easy conversation.
Mm-hmm. Mm-hmm. Yeah, it can be hard, especially, somebody's coming in for your opinion and you don't want to just go and say, well, you've got bags and sagging and, you don't want them to feel worse about themselves. But I feel like my role is more like an educator, and I treat a consultation as kind of like a fact-finding situation for the patient. So they're coming to me and asking what their options are, and I just do my best to tell them, to my knowledge, what the options are, even if that's doing nothing or even if it's surgery. And so I do frequently recommend surgery, or I'll say, that's going to be your best option is, a facelift or a brow lift or a blepharoplasty or something. But then I'll say, if that's something you're not comfortable with, or you don't want to do that right now, then these are your other options. And I just approach it from a top-down perspective. So I'll start on their forehead, I'll break it down into thirds, and I'll explain what I'm seeing and what happens as we're aging, bone loss and volume loss. I'll point out a nice feature, because everybody has a pretty feature, whether it's their skin or their eyes or their hair or something. You don't want to just go and talk about a bunch of negatives. I like to bring up some positives too. And, then we just go down temples and cheeks and jawline and tear trough. And that's just my approach to it. And it's kind of evolved a little bit over the years. And I feel as I've been in this industry longer, I do feel more comfortable in saying no to certain things as well, where as a newer injector, I would just, take everybody on. Not that I thought I could, fix everything, but that's how we learn. We learn by mistakes. And even now, if I get a patient in and they saw another injector, and if they weren't happy with their work, I encourage them to go back to their injector, because that's how we learn. And I know I'm not perfect, and I make mistakes. And if my patient goes to another local injector, they probably know about it. But if the patient comes back to me, then it gives me the chance to correct it. And then I learn in the process too. So I think it's just a lot of being open and, realize that we're continuously learning. A patient asked me the other day, where did you get your training? And I'm like, well, I'm still training. I mean, to this day, I'm always learning, whether it's going to a conference or online or, talking to colleagues on social media. I'm still constantly learning, because this field is always evolving.
I 100% agree with you in the fact that if they're a good injector, they're definitely have the patient go back and, go to where they had that work done, just because if they're a good injector, they're going to make it right. And I love the aspect about how it is a learning experience. We all do make mistakes, and we're all constantly learning in this field. Right.
And if you're not, then that's the time you need to hang it up, because that's when you become dangerous.
Right. So in terms of, trying to find trainings, since you have been in the industry so long, what is your criteria for finding a training after being so advanced within the field?
I tend to do more niche trainings now. I did Arthur Swift and Sebastian Codafana last year, and that was great. It was a 2-day, really intensive cadaver lab.
Oh, I bet that was amazing.
Ultrasound. Yeah. So I tend to do these more focal trainings now. Ultrasound training, cadaver labs. I'd really like to go overseas and, to the UK and train with some injectors over there, but more individualized trainings as opposed to, just big conferences where you just listen to lectures, because while that's important and it's helpful, for me, it's the more hands-on that I'm really going to learn and, pick up new techniques and tips for, what I'm doing every day.
I bet that training was amazing that you went to last year.
Yeah, it was really good. I wish it was like 2 more days. We could just, soak up more of their brain, because they are just, incredible teachers and just a wealth of knowledge. It was fantastic.
Well, I'm very jealous. Do you feel like within the industry, there's kind of a hierarchy of, between RN injectors and PA injectors and the injectors who are MDs and they are injecting? Are you seeing, I guess, kind of a divide or a difference? Or are you seeing majority collaboration? And it doesn't really matter what you have as a degree.
Yeah, I really don't see much divide. Like, I started my Instagram about 4 years ago, and I was kind of bracing for that. Like, the dermatologists and plastic surgeons or physician injectors, or, where am I going to fit in with the nurse injectors? And then the more I was in it, it's like, we're all doing the same thing. We're all learning at the same rate. It's not like there's, a residency for injectors,
right.
in medical school. We're all basically learning the same techniques and the same anatomy at the same time, or, wherever on that timeline you are. So I was, pleasantly surprised that I really didn't see much of that. I mean, there's little ones, here and there, but we just kind of ignore those. But I think for the most part, it's very collegial, and at least everyone that I've come into contact with has been very open to sharing, and they don't feel like they're better because of whatever degree or letters that they have after their name. So, I mean, I love that. And I think that's the nice thing about social media is you can set up your circles the way you want them to. So you put people in your circles that are, encouraging and, or similar in your taste and practice, and who are, just encouraging and good friends. And you do find, friends along the way, and injector friends, because we, run into each other at meetings, and you wind up talking to a lot of the same people. And then you develop this relationship outside of just injecting, you actually do become friends. And it's really nice, because I think when you're practicing, I'm in private practice in a large dermatology group, and there's 7 other providers, but we're all busy, and we don't get a lot of time to just chat back and forth on, well, what would you do in this scenario? Or, we have some, but it's not as much as, okay, well, now I'm home, in the evening, and I can, log in or, go to my group text and, ask about what would you do with this patient. It's just a little bit easier to do that on your own time. But I love that aspect of social media. That's been huge for me.
Well, that's awesome. I'm sure that your business and kind of everything within the aesthetic industry has changed since social media has come about, and since you started that Instagram. But I like the positive aspect that, you're making that collaboration and that friendship that is helpful in your business, but also, someone to hang out with in the long run as a friend.
Right. Because these are people that we're going to be, quote unquote, working with for years to come, as long as we're in the industry.
So I have to ask you, have you experienced burnout being in the industry as long as you have?
I really haven't. I mean, occasionally I need a vacation, but
doesn't everybody?
Yeah. Right. I really haven't. But I structure my schedule in such a way that I have downtime, I have family time. And to me, that's super important. I could work 6 days a week, 10 hours a day, and see probably everybody on my wait list. But, to me, I mean, there's only one of me, right? And if I'm burned out and unhappy, I'm not going to be a great provider for the people who do want to come see me. So I'm protective of that time. So I work 4 days a week. I work during the hours that my kids are in school. And then I leave at 3 and I go pick them up, and then I start that job, which is mom. And then somewhere in there, I do my third job, which is social media.
Oh, it's a whole job in itself, of course.
Yeah.
I 100% agree.
It really is. It really is. And my husband's in there too. So that's kind of family. So that was always really important to me, is to, be able to be a mom and to be a wife and to have a satisfying career. And, it's just all about finding that balance, right? It's always the work-life balance that we're looking for. And for me, this is what works for me. It may be different for other people, but it's worked for me to where I really don't feel burnout. I mean, even during the busy season, quote unquote, busy season at the end of the year, when everybody wants to get everything done, and, we tend to work more hours. I'm still protective over that time, and, this is when I'm available. So that helps for me.
I love that you've set boundaries and that you really prioritize not just your job. I love that this industry gives you that flexibility. I don't have kids yet, but that's kind of my hope as well, is to, be able to work when they're in school, and then, be able to do the other things with them and not miss out. So that's
right.
awesome.
Right. Yeah. Because we're not saving lives here. So we don't have to work 24-hour shifts and things like that.
Right.
We can be reasonable with this. Aesthetics is fun, but I don't think you have to kill yourself to do this because, again, at the end of the day, you have to take care of you. And if you're unhappy or burnt out or, you're just frazzled, you're not going to be able to think as clearly for your patient. And ultimately that's, what we're here for. And that's what we want to do. So yeah, I think it's important to protect those boundaries and do what's best for you. And again, it may look different for everybody, but that's just what works for me.
Well, I love that. I love that you actually haven't even experienced burnout because you've set those boundaries for yourself. So that's really great to hear.
Yeah.
I did want to congratulate you guys on the fact that you guys are no longer considered physician assistants. You guys are now physician associates.
So yeah.
Yes. Was that exciting? A long time coming? Or I guess kind of your thoughts?
It was a long time coming. We originally started when the profession was founded almost 60 years ago. We were in several of the programs. There were physician associates, and then there was some political stuff that happened. And then we were renamed assistants. But, it's that title is just so non-descriptive for what we do. And, even to this day, I get an email the other day and they're like, I'd like to speak to your doctor. I'm like, I'm a full-on medical provider. Why are you asking me to email her directly? It's like the assistant title is such a misnomer and so not descriptive of what we do. So, fortunately, we're going to have to wait till all the states roll it out. And then one by one, it'll, become more consistent. But yeah, officially it's physician associate. I think it'll be helpful, because even if we're trying to, pass laws where, to not just expand our scope, but to practice at the full extent of our ability, lawmakers see assistant and they're like, well, an assistant can't run a practice. But PAs run practices all the time, but they don't understand that we are trained to practice medicine, that we can prescribe medications, that we order, interpret lab tests. We are trained in medical school, but they see the assistant and think, well, that can't work. And so it's really inhibited our growth. And so I think just that tiny thing of changing our title will help in, there's this thing called optimal team practice that PAs are pushing for right now, and where we still want to work as a team. We still want to work with physicians. We don't want to go out and practice on our own, but just to remove the barriers that are preventing us from providing care.
Yes, I agree. It sounds like there's still lots of work on that end, to kind of really get to where PAs get kind of the recognition that they deserve. But that's exciting that it's moving towards that direction.
It's coming. Yeah, it's coming. Very exciting.
So in terms of, for my followers to kind of find you on Instagram and find your place of practice, where would that be?
So my Instagram handle is April Harrison Derm PA, and there's an underscore between each word, but you can just put April Harrison and I'll come up. I have an Instagram page and it has my bio and practice info there. And then I also post to my Facebook page too. Instagram's more active, it seems. I think people are more interested in commenting there than Facebook, but you can find me on both. And then my practice is SBA Dermatology. It's in Houston. It's also called Suzanne Bruce and Associates Dermatology, but we're transitioning to SBA Dermatology. So they have their Instagram page. I have my Instagram page. A lot of the providers have an Instagram page as well. But yeah, check me out on Insta and be happy to have you follow along.
Perfect. Well, thank you so much, April, for coming on the podcast. I think my listeners are really going to enjoy the episode. We touch on a few different things. You're my first physician associate on the podcast. So I thought that was really exciting.
Exciting.
Yes.
Well, thank you for having me. It was an honor to be here. I appreciate it. And look forward to checking it out.
Awesome. Well, thank you so much. Thank you again to April Harrison for coming on the podcast today. I really enjoyed our conversation, just, about everything aesthetics, as well as, the role as a physician associate in comparison to, some of the other injectors I've had on the podcast thus far. I love your educational aspects of your Instagram feed, so definitely go check that out, listeners. She has some great little pearls on there. Stream the podcast on my website, aestheticnursekiki.com. Also on the website, you can find some fun apparel, so check that out. And finally, my personal Instagram is at aestheticnurse.kiki. All right, beauties, have a great day. Bye.